Liberia has confirmed at least three COVID-19 infections. Government has taken action by closing schools, churches, and has banned travel from countries with more than 200 cases. All flights have been banned except private or charter planes. COVID-19 and Ebola have some similarities, but are different in many ways. Though public gathering was banned during the fight against Ebola, religious centers were never closed. There wasn't social distancing, and businesses were not affected as they are right now. During the time of Ebola, I locked my family up while I went out to search for provisions. This enabled me to keep my family safe and away from other people. I'm doing the same right now, but this time I am indoor with the kids while my wife is the one going to work. We have a bucket of water outside the house mixed with disinfectants so that whenever she comes back from work, she washes her hand and ensure that everything she touched is clean before entering the house. In terms of regulations, information dissemination, and institutions charged with responsibility to respond to outbreaks, Liberia is prepared. But economically, Liberia is not prepared at all. During the Ebola outbreak, Liberia depended on countries that are now badly hit by the virus. This time, Liberia might have to depend on herself more. Nonetheless, the Ebola virus was not eradicated using mainly medications. Rather, people' willingness to change their behavior. For example, wash your hands often, do not shake hands with people, do not touch dead bodies, allow government to bury your loved ones, do not allow strangers in your communities, call the health workers if you notice that someone is showing symptoms. These regulations, medical treatments, and listening to authorities became the answer to the Ebola outbreak. My advice to people in Europe and the US is this: please listen to your authorities, your health workers, and contribute to the fight against COVID 19 by self isolating and respecting simple rules. Do not politicize the fight against the virus. Fight the enemy first and do your politics later. Do not undermine efforts made by other people who are fighting to make your community safe again. Liberians are optimistic that they can defeat COVID 19. You hear people saying everywhere, we kicked Ebola out and we can kick COVID 19 out also. It is just so sad that Liberia, a small, poor country, will go through all these crises. We experienced 14 years of civil war, the Ebola crisis, and now COVID 19. This is just too much, but Liberians are people of resilience, and even this shall pass. My family and I are coping very well. We believe that this will pass. As long as we can get food to eat, our priority is to stay alive. We will do our part in kicking COVID 19 out, just as we did before with Ebola. It is quite a financially challenging time since my only source of income is tourism. My income source has been invaded by this virus, and will do all I can to kick it out. I urge you to join the fight, even if it is by doing the very little things. Little things matter.